important component of our program is ultimately compassion for the patients, and that includes cultural sensitivity and cultural awareness, and we review that very thoroughly. We have bilingual speakers, especially with Spanish. We also have bilingual speakers in a multitude of other languages, which is very important to be able to communicate clearly with each of the patients, and that's both with our front office as well as with our dental staff.
¿Tienes más citas?
Sí.
¿Para regresar, para que le hagan más tratamiento?
Sí, me van a rellenar los dientes.
Ok. Y limpiezas
Y
también.
limpiezas también.
Ok. So, entonces la miramos para atrás para sus próximas citas.
Ok.
To cover the bridge and you mean for the one that's working?
Yeah, they're gonna make it. Medi-Cal will cover a bridge for her in the front, so that means crowning her teeth. Yeah.
Okay, so she won't have a plate no more, or?
No, she won't have a plate.
And then
Oh, okay, cool.
maybe get a bit. Well, I don't know if this goes to him, but maybe to you.
No,
Maybe get a bit more thing because
she's looking, but she's deaf and don't speak. And a lot of people won't hire her, so she's.
But she is looking.
Yeah.
That's great because.
So, what do you think? If you take the money out of that, whatever.
My name is Hugo Fornito. I'm the clinical director of Dientes. We're a community dental health center in Santa Cruz. We're very happy and proud that we provide comprehensive dental care. We're not an emergency clinic or anything like that. We provide dental coverage and dental services just like a private practice, but we do it to the underserved community of Santa Cruz County.
While we wait for the doctor, I'm going to go ahead and let you pick out a toy, okay? Go around this side. Right over here. Pick one, okay?
Dientes, in terms of the scope of services that we provide, we have a pedodontist on staff, which is, we are the only community dental clinic in the area that does that. We also stay open very late. And good news for the benefactors is, in terms of the efficiency of the business, we do have 10 operatories. We start off with 3. And we've been very fortunate to receive the types of funding and support that we have in the community, as well as institutional grants. And we've used every single dollar as effectively as we possibly can. So while we have 10 operatories currently, we maximize the use of each dollar. I think that's really important. So we started off seeing less than 5,000 encounters a year, and we've grown to almost 17,000 encounters. And our goal is to ultimately expand that considerably, because the community has a real pent-up need. If you look at Medicare data, it suggests that there's over 20,000 beneficiaries in the county, and unfortunately we are serving less than 20% of that if you look at all the community clinics that are providing dental care. So there's a huge disparity in terms of the need versus the available support services. And so when we talk about growing our services, it's not simply for the sake of growth, it's because there's an actual need there. About 80% you could argue is unmet need. So I think those are some important things for our benefactors to realize, that when they give dollars to our organization, we use that and we really try to maximize the effectiveness of each dollar.
I've always been able to get in within at least 2 weeks. And it's inexpensive. Yeah, it's huge. So and they take payments as well, so you can afford to get an ongoing procedure done. So.
¿Tuve que esperar mucho o le fue bien? Everything was good scheduling her appointment.
It doesn't take very long to get in. You don't sit and wait here by yourself.
Son muy buenos, muy
pacientes con
Very
los
good,
niños.
very patient.
I would like to specifically thank all of the benefactors that have given so generously to our program, and we really will look to you in the future. We're really thankful for the support that you've given thus far, and it's really a vital service that we provide, and we thank you for helping us to do so.
I think it is fundamental for people to understand what a struggle it is for us to be able to keep our doors open. The state budget this year made it almost impossible to expand, and hopefully we don't lose the state benefits that allow us to keep our doors open. So it's always a struggle to pay our bills, but we are really responsible to our mission, and we will continue to do so.